Stapes is the smallest bone in the human body. It is part of the middle ear ossicles. Middle ear ossicles attach themselves to the tympanic membrane outside and to the oval window of the inner ear inside. The middle ear ossicles are malleus, incus and stapes, and the stapes is the innermost ossicle. The function of the ossicles is to transmit sound from the tympanic membrane to the inner ear. They also help to magnify the sound to some extent. Transmission of sound from the tympanic membrane to the inner ear takes place because of the movement of these ossicles. In a condition called otosclerosis, the movement of the stapes bone gets restricted because of certain deposits. These deposits fix the stapes to the footplate and its movement gets dampened. Because of the dampening of the movement of the stapes, sound transmission suffers and less amount of sound reaches the inner ear. This causes the patient to lose hearing in that ear and leads to conductive deafness. Usually otosclerosis causes conductive deafness, but sometimes there is a variant of otosclerosis called cochlear otosclerosis, in which the focus moves into the inner ear and may cause sensory neural deafness as well, in which case the patient will have a mixed deafness, fixation of the stapes causing the conductive component, and involvement of the cochlea causing the sensory neural component. The treatment of otosclerosis or stapes fixation is surgical. There is no medicine that can take care of this situation. It has to be treated surgically. In the surgery, we remove the fixed bone and in its place we put a prosthetic device or an implant, which could be a piston, or there are many other implants that are available which take the place of the ossicle that was not working. The surgery is normally done under local anesthesia or modified anesthesia care because we want to document the patient's improvement of hearing on the table. That is why we prefer not to use general anesthesia in these cases. The surgery is technically difficult. We use an operating microscope. We use certain micro drills inside when we make a hole in the footplate. In the surgery, we open up the eardrum. After we've exposed the stapes, we diagnose and confirm the fact that the stapes is fixed. We gradually piece by piece remove the stapes and insert a piston in its place. The surgery roughly lasts about an hour or so. It is a technically difficult surgery. The results are usually gratifying, but every patient must remember that a stapes surgery carries with it risk of total loss of hearing. Though the instance is rare, but it is always there. In the best of hands, in the best of facilities, sometimes a stapes surgery can lead to loss of hearing, and this must be known to the patient. An option for not getting operated is to use a hearing aid. Because largely it is a purely conductive hearing loss, hearing aids are effective and work very well in the presence of otosclerosis. Patients begin hearing well immediately. The advantage of a hearing aid is that there is no side effect of using a hearing aid. The disadvantage of a hearing aid is in the presence of activity of the disease inside the middle ear, the disease may continue to progress. A hearing aid does not treat the disease, nor does it halt the disease. So one must be aware that if one chooses to use a hearing aid, one must get audiograms done at least 6 months to 1 year interval to know whether the disease is progressing or not, in which case further down the line a decision can be taken to operate if the disease is found to be progressing. There are some restrictions to patients who undergo stapes surgery. Immediately after the surgery, one should not travel by air or cause any pressure changes to the middle ear because that can disrupt the ossicle. So especially air travel, we request you to avoid for 4 weeks after the surgery. There are some recreational activities like scuba diving in which we tell our patients not to undergo because the pressure changes may disrupt the ossicle. Some careers like defense forces where you have to go to extreme high altitude, or Air Force pilots where pressure changes happen while the pilots are engaging G-forces may be a little detrimental to a patient who's undergone a stapes surgery and sometimes is a cause for rejection as far as their medical is concerned. Otosclerosis is a gradually progressive condition. It causes fixation of the stapes bone in the footplate and prevents transmission of sound from the external ear to the inner ear.